Hi, welcome to ABM University Virtual Classroom. Today you will be taking the course called the Scribe Medical Documentation Course. Let's get started. What is a scribe? A scribe is a person or paraprofessional who specializes in charting physician-patient encounters in real time, such as during medical examinations. They also locate information and patients for physicians and complete forms as needed for care. Documentation guidelines. Medical records should be complete, legible, and include the following information: the reason for the encounter, relevant history, findings, test result, and dates of service. 2. Assessment and impression of diagnosis. 3. Plan of care with date and legible identity of the observer. 4. Documentation that supports rendering billing provider indicated on claim is the health provider of the service. What are the 5 C's in medical documentation? The client's words. What did the client state? Clarity, completeness, conciseness, and chronological order, as well as confidentiality. Again, the 5 C's in medical documentation are the client's words, clarity, completeness, conciseness, chronological order, and confidentiality. Next, what should be documented in a patient's record? 1. All relevant clinical findings. 2. A record of decisions made and actions agreed, as well as the identity of who made the decision and agreed on the actions. 3. A record of information given to the patients. And 4, a record of any drugs prescribed or other investigations or treatments performed. Proper documentation, both in patients' medical records and in claims, is important for 3 main reasons. 1, to protect programs. 2, to protect your patients. And 3, to protect you and the provider. Methods of documentation. SOAP. SOAP is problem-oriented documentation. It stands for subjective, objective, assessment, and plan. Subjective information is information that you can't see. It's information that you collect from the patient, such as the patient's name, age, and other information that someone tells you, their chief complaint, or their medical history, meds, allergies, and pain level and the location of the pain. Objective information is information that you gain on your own through observations, such as age, sex, approximate weight, level of responsiveness, and your impression. An assessment is what you may think is wrong with the patient. P involves the plan. It is what the physician intends to do about the problem, such as treatments and or medications. Another form of problem-oriented documentation is called PI technique. It is where you state the problem, you form an intervention, and then you evaluate. So an example of this would be, the problem is the patient has hypertension. Intervention would be the medications that the doctor put the patient on. And then the evaluation would be, after the patient has successfully taken their medications, you recheck the blood pressure and what was the outcome. That would be an example of pie charting, problem, intervention, and evaluation. What are the 4 documentation guidelines? The 4 documentation guidelines are the reason for the encounter, relevant history, findings, test results, and date of service, assessment and impression of diagnosis, plan of care with date and legible identity of observer, documentation that supports rendering billing provider indicated on claim is the health provider of the service. What is a medical scribe? A medical scribe is a person that is a paraprofessional who specializes in charting physician-patient encounters in real time, such as during medical examinations. They also locate information in patients for physicians and complete forms as needed for patient care. What are the 5 C's in medical documentation? The 5 C's are the client's words, clarity, completeness, conciseness, chronological order, and confidentiality. What are the 3 main reasons for proper medical documentation? The 3 main reasons are to protect programs, to protect your patients, to protect you, and to protect the provider. What should be documented in a patient's medical record? All relevant clinical findings, a record of decisions made and actions agreed, as well as the identity of who made the decisions and agreed the actions. A record of information given to patients, a record of any drugs prescribed, other investigations or treatments performed. What is SOAP documentation? SOAP is problem-oriented. It stands for subjective, objective, assessment, and plan. What is PI documentation? PI documentation stands for problem, intervention, and evaluation. Thank you for participating in ABM University's virtual classroom with Dr. Angel Real.